If you have any experience with addiction, then you're probably pretty familiar with all the models and viewpoints and still may be pretty confused or overwhelmed by it all. Is it a disease? Is it a moral failing? Is it a choice? And I get it, because most professionals in the field can't even agree on what causes addiction or keeps somebody stuck there, which unfortunately also means the way it's treated and success rates of that treatment are going to vary pretty significantly. Most programs focus on cognitive behavioral therapy, which really just looks at how a person thinks and behaves, but doesn't get to the root. If you're new here, I'm Bonnie Adams, a licensed family therapist, and as someone who grew up in a family system fragmented by generations of addiction and abuse, and living in survival mode myself for so long, I know how crucial it is to start living again. So I've dedicated my life to helping people recover and regain their true selves so they can end the cycle and live peaceful, fulfilling lives. If this video resonates with you, like, comment, subscribe to catch the rest of this series, gain more insights, and gather more helpful healing nuggets for your own toolbox. Now, I want to introduce an idea that might feel unfamiliar at first, but once it clicks, it really explains a lot about addiction and why it has the grip that it does on you or someone you love. Years ago, when I was working in residential and intensive outpatient treatment programs, I was in charge of facilitating multiple therapeutic groups daily. And after a while, the same old curriculum runs pretty dry and doesn't really get in deep. A lot of my clients wanted to learn why they became addicted and what they could do about it that would actually create change that would last. And in my search for new curriculum for these groups and to offer something a little different, maybe even novel, I came across this workbook called Power Over Addiction by Jennifer Fernandez, and I decided to try it out. Now, I was familiar with the harm reduction model, but that's not something most treatment programs promote, so it wasn't offered in any of the groups I facilitated. If you're not familiar with harm reduction, it's a more non-judgmental approach that focuses more on incremental change and destigmatizing substance use. This model doesn't really push the "you're bad if you're addicted" narrative, and instead just treats people like humans, which is what anyone truly deserves and wants. We all deserve our dignity, don't we? In this workbook, Fernandez talked about the addiction as if it were a relationship, something I had never really considered. I was young and naive, and growing up surrounded by addiction, I was pretty pissed and only wanted to think of addiction as an enemy I wanted to destroy, as I'm sure most of you have also felt. I was convinced addiction was totally about trauma and people were self-medicating the demons that kept them stuck. And sometimes maybe it is that, but that's not all that it is. I was curious about this, and so I started digging a little deeper, and I found a whole slew of research and publications on addiction as an attachment rupture. And that's when things really started to click into place for me and my clients. Now, fast forward a few years, and I became certified in depth psychology, which was developed by Carl Jung, and even more pieces of the puzzle fell into place. By the way, did you know that Carl Jung and Bill Wilson, who is the co-founder of Alcoholics Anonymous, were close, and the concept of AA was built on Jung's individuation process? Now, if you're discouraged by AA, don't worry, I'm not going to launch into all that. This video isn't about that. But it is about that internal process that addiction stunts. So after all this, I started approaching my clients in recovery with an entirely new way of thinking about addiction and recovery they had never considered. And I started to see that in some people, the old models just weren't going to work, and actually seeing addiction as an attachment process, a relationship of sorts, they were able to get a better handle on something for them seemed entirely intangible. Until we were able to, in a strange way, humanize it, to them it always felt like they were trying to grasp smoke. But when they were able to give it shape, substance, so to speak, they could grab a hold of it and get a better look, observe it, and understand its mechanism of action that was unique to them. So we turned their addiction into a woman. Yes, you heard me right. I'd ask them, what if insert your drug of choice or behavior of choice was a woman? Think about the relationship you have with her. Would you take her home to meet your spouse, your kids, your parents? Would you take her on family vacation, on a work trip to meet your colleagues? Would you have her over for supper? Would you allow her to be alone with your partner and have no concerns about what she might whisper about you? Would you invite her into the most intimate parts of your life without any pause? And when I ask people that, I get a resounding no. This framing also resonates for their partners because the relationship their loved ones have with their substance feels very much like an affair. There's secrecy, betrayal, lying, manipulation, theft, and abandonment. And their partners feel like they are in competition with something that has too strong of a hold on their person that they'll just never be able to get through to them. Now, even though the addiction itself has infiltrated every aspect of their lives, caused harm to others and harm to themselves, the addiction is separate from the substance or behavior, and the addiction is just what fuels their relationship with the substance or behavior. The relationship that someone has with their substance or behavior of choice is actually very sacred to them. And I'll explain more about this later in the video. I want to be clear here though, I'm absolutely not excusing harm or romanticizing addiction in any way. Accountability is still key. What I want to do is offer a different perspective on why certain substances, behaviors, or even people can start to feel like they're holding someone's emotional world together. And I'm not saying that women are like drugs or toxic, so bear with me here while I explain why the archetype of woman makes sense. You might find this intriguing. In Jungian psychology, there's a concept called the anima. The language can feel old or abstract, so let's make it simple. Think of the anima as the part of you that feels, the part that holds longing, sadness, creativity, desire, grief, imagination, and the need for connection. It's your inner emotional life. In traditional Jungian terms, the anima is the internalized feminine for men, and the animus is the internalized masculine for women. There is some debate about whether we have aspects of both regardless of gender, and some will say no, but for the sake of this perspective, we're going with yes. When someone doesn't know how to access that part of themselves safely, they don't stop needing it, they just go looking for it somewhere else. That's where addiction comes in. All my time working in the field of addiction and hearing how people refer to their addiction, it's very clear to me that their addictions presented much like various types of relationships, mostly abusive and toxic, but also very sacred to them. For some people, a substance or behavior becomes the place where feelings live. Drinking isn't just about getting drunk, it's how they relax enough to feel something. It's how they grieve, it's how they feel confident, it's how they turn down the volume on shame. Gambling, porn, drugs, work, even certain relationships can serve the same function. They're not just habits, they become emotional regulators. You might have heard people say things like, "It's the only thing that helps," or "It's the only time I feel like myself," or "I don't know who I am without it." And they're not exaggerating. Psychologically, the addiction has become their relationship with their inner world. Many people with addiction histories were never taught how to sit with feelings, ask for comfort, or process distress without being punished or shamed. Their nervous system learned that certain substances reliably change how they feel, and that is sometimes the only consistency someone has experienced. Over time, the brain bonds to that relief. Carl Jung was pointing to the same thing, just with different language. Now, here's where this gets especially important in relationships. When someone is using addiction as their emotional container, the people close to them often get pulled into that system. You might notice that they lean on you to manage their feelings. They want you to calm them and reassure them, absorb their distress, or help them feel okay when the substance isn't working or it isn't available. You become part of the regulation system. That's why setting boundaries can feel like you're ripping something away from them. That's why they might panic, rage, collapse, or promise everything when you pull back. From the inside, it doesn't just feel like you're leaving, it feels like they're losing access to their emotional lifeline. Now, this doesn't make harmful behavior okay. Control, manipulation, and abuse are still real, but it helps explain the intensity, the desperation, the way addiction can look less like a bad habit and more like a relationship. And it also explains why sobriety can be absolutely terrifying. When someone stops using but hasn't built any internal way to feel, reflect, or self-soothe, everything comes rushing in at once. I saw this a lot when I worked in residential treatment. Anxiety spikes, anger shows up, shame gets louder. People around them might expect immediate stability, but internally they've just lost the one thing that helped them manage their inner world. This is why relapse risk is so high during emotional overwhelm, loneliness, or conflict. It's not about willpower, it's about capacity. Healing from this perspective isn't just about stopping the behavior, it's about building a relationship with the part of yourself you've been avoiding. Learning how to feel without escaping, learning how to stay present when things are uncomfortable, learning how to tolerate longing, disappointment, and fear without immediately trying to shut them down. Now, for partners and family members, this framework can be relieving in a strange way. You weren't failing to love them enough. You weren't competing with a substance because you weren't enough. You just were never meant to be someone else's emotional container. In the episodes ahead, I want to talk more about how this dynamic plays out in relationships, how it intersects with control and abuse, and what recovery actually requires when addiction has been standing in for emotional connection. For now, just sit with this idea. Addiction isn't only about escape. Sometimes it's about connection, misdirected and costly, but very deeply human.